Hello, viewers. Welcome to another episode of The Cure for Your HIV, where we value your health because your health is gold. My name is Mariam Moses, and I am a public health practitioner. I'm very passionate about the health and wellness of people, especially people living with HIV and AIDS. I actually work to support change so that people around me and around the world can have the knowledge to make informed choices and also take control of their sexual health and general lifestyle. And this is in collaboration or in support of the global effort to end AIDS and achieve a sustainable development goal for health worldwide. So on this channel, if you're looking for testing, if you want to access care and treatment or linkage, or if you want to know more information about sexual transmitted infections and prevention, or maybe you'd like to know some honest advice or truth about sex and relationship, you will find all of this and a lot more right there in this channel. So kindly subscribe to my YouTube channel and hit the notification bell for new updates. Relationship is very important in this field. So like I said earlier, if you really want to know how to go about your relationship, you can chat me up in the comment section, or you can send a message, a private message to my email, and I will respond to you. However, today we will be talking about a very important topic, and trust me, you'll be glad you did. We're going to be talking about the diagnosis of HIV in men versus women. Right? Now, of course, what is HIV diagnosis? HIV diagnosis is a procedure. It's a procedure used, or that is being used, to detect if you have the HIV. Mostly it's been carried out by the doctors, followed by the lab scientists and other health practitioners until your result has been obtained or your final status is being determined. Now, HIV diagnosis can also be described as what we call HIV testing or HIV screening. Now, what do you understand by the word HIV screening? This HIV screening we're talking about is the only, way to know if you have the virus or not. Now, there are several types of tests, that is usually done on any specimen, recommended specimen taken from your body in order to confirm whether you have HIV or not. I will talk about those tests in my subsequent slide. The importance of this HIV diagnosis is that if you have the virus, finding out quickly means that you can start your treatment right away. Alright? If you have the virus, knowing your status on time means that you can access care and treatment, or better still, you can start your treatment right away. And this is going to give you, you're going to feel better, and also you're going to live longer, and also have full life, and also live life the way you're going to enjoy it. I mean, live life to see that you take care of your children, take care of your family, achieve your desired goal, become who you want to be in life. So this also can help you to take starting steps so that you don't pass this HIV on to other people, especially your loved ones, your children, or any other person around you. Why? Because you love them. Now, for pregnant women, I had advised that you should go get tested early, because early treatment means you probably won't pass this HIV onto your unborn child. So actually, the CDC, which is the Center for Disease and Control, recommends that everyone, between the age of 13 and 64 get tested for HIV at least once in a year. At least once in a year. Why? Because it is very important, especially if you are at higher risk of getting this HIV infection. And what I mean is this: if you've had several sexual partners, or you have several sexual partners, then you should make it a routine, to check in your HIV status. And then if you've had unprotected sex with someone who is or could be HIV positive, including someone whose sexual history you don't even know, then you should go ahead and get tested. Ensure you make it a routine to knowing your status. And then if you are the one or the type who injects drugs, who does self-injection, that is, you inject yourself with needles or syringe or any other devices that someone else has used first, then it is important you go to know your status. And then if you've had or you are getting tested for tuberculosis, hepatitis, or any other sexually transmitted diseases, which include syphilis, gonorrhea, chlamydia, or herpes, please go and get tested, okay, so as to know your status, all right, for HIV. And then if you are a sex worker, please, it is important you know your status part-time, so that you will know how to manage your health better. And then if you've had sex with someone who has the history of the above mentioned diseases, please kindly go and get tested, all right? Kindly go and get tested, okay? So of course, doctors will actually require certain specimen, both woman and the man, to draw their conclusion about your HIV status. So HIV test in between man and woman has just little differences, because of course there are things the doctor looks out for in a man, and then there are things he looks out for in a female, for him to draw a conclusion as per whether the person or the patient is positive or not. Now, we have certain types of specimen or samples that is mostly used in the hospital or in the laboratory to carry out this HIV testing. And some of these samples or specimen is the whole blood specimen. We have the dry blood spots, we have the oral sample, and sometimes urine can be used. And then we also have the plasma. Now, I'll talk about some of these specimen. Now, the blood sample for HIV testing, okay? So, blood tests are the most common way actually to diagnose HIV, okay? It is the most common way, and it is the most effective. Yes, it is the most effective, okay? So now this blood test actually looks out for the antibodies, to the virus that the body creates in an attempt to do what? To fight the virus. So once if you are exposed to this virus, please, it is very important for you to get tested immediately. Okay, although it can take the body anywhere from 6 weeks to a year to develop these antibodies that responds to HIV virus, but nevertheless, it is very important for you to go know your status. Having known what the symptoms of this HIV are, like in my previous videos, I talk about what the symptoms of this HIV are, both in male and females. So once you see the symptoms, please don't hesitate, just go and get tested just to know your status. All right, okay, so I'll talk about oral fluid and urine sample for HIV testing. Okay, now, of course, kissing has been considered as one of the ineffective way of transmitting this HIV infection, but nevertheless, okay, this ranges from, this is a plus or minus conclusion, or will I say hypothesis. So it ranges from negligible to non-existent at all. So, but then oral fluid can be used to determine the certain virus, because this looks out for antibodies but not the virus itself. Okay, the oral fluid test just looks out for antibodies that are responding to certain kind of infection or virus in the body, but it doesn't dictate whether it is HIV virus or not. I'll still talk about that later. Now, the urine test, okay, is also can be used or may be used, okay, but it's not really as accurate as the blood. All right, however, it also looks out for antibodies then, but it may or may not be used. Okay, now this is a picture of the dry blood spot and the plasma specimen for HIV test. This is how it looks, and the dry blood spot is mostly used for babies to detect whether they are positive or not. Then let's quickly look at how this oral quick for HIV self-testing works. How does it work? We have an apparatus or an equipment known as the oral quick. Now, what is this oral quick? Oral quick it can be used at home. Is a home used apparatus. Let me put it that way. It is a rapid self administered apparatus to detect whether a person is positive or not. So it can be used it is used in collecting some specimen from your mouth, and I will describe how it works. Actually, it is an approved it has been approved to check antibodies for HIV type 1 and HIV type 2. Now, the virus that causes, which is the virus that causes the AIDS. Now, this particular kit, the oral quick, it is designed to allow you to take the HIV test anonymously, and of course in private, with the collection of an oral fluid sample, by swabbing your upper gum and your lower gums with the test device. So it is either anti-clockwise or clockwise, whichever way you want to do it. But in as much as you are able to collect this sample from your mouth, from the upper gum or the lower gum, then you are good to go. Now, after collecting the sample, you then insert the device into the kit vial, which contains a developer solution. Now, then you wait between 20 to 40 minutes, and then you read the test result. Now, look, this is it. Take note, a positive result with this test does not actually mean that an individual, a person is definitely infected with HIV. Okay, so but rather what but additional test is what is required, and it needs to be done, to confirm the results, okay, whether you are positive or not. And then additionally, a negative result actually doesn't mean that an individual is definitely not infected with HIV. Okay, so particularly when exposure, once you are exposed, you once you discover that it is negative, then you can wait for some previous months, for some months rather, within maybe 3 months, and then you go ahead for a confirmatory test in a medical setting, in a medical environment, so that you know whether you are positive or not. And then I said that this testing should be done, you should ensure that you do your testing as regular as possible. All right, so it can take some time for the immune system to produce enough antibody for the test to detect, and then this time it actually varies from person to person. So it is, and then in my previous video I talked about that time as window period. So however, it's very important for you to go and go get tested. Okay, that's that about the quick oral quick. Then I'll talk about how common is HIV in men and women. This is very important because a lot of people have been asking questions, about the fact that how do they know if actually is it if the man who is more vulnerable to HIV or the woman. Yeah, actually women are more biologically vulnerable to HIV infection, and especially in Africa, okay, because they are less able to cope with it due to cultural and social economic factor. So, and then in the past, vulnerability happens to be high in the past few years, but presently the rate of infection among women is very, very high. So nearly 60% of infections at the moment are in women, and most of them are even in younger women, usually between the age of 15 and upward. So the psychological data seems to actually indicate that women can get infected. The rate at which women get infected is as twice as that of men. Okay, so and then especially in South Africa now, with the focus in South Africa, we have women within the age of 15 and 24, and of course not just South Africa, West African as well. They are more exposed HIV positive than men of the same age range, and this is because, like I said, we have one of the reasons are psychological, socio-cultural factors, and though infections also often occur between older men and younger women, so there is a greater chance of the women, a woman partner being positive. And then another thing that makes a woman to become more vulnerable is because of the immature vaginal tract, so which is easily infected. Of course, we have these cases of adult minor young women getting married. That's what I mean by that is early child marriage. Okay, they are neither adult, neither are they adolescent, so they get married on time, and of course their body is still tender, so it gives pave way for HIV infection. And of course, during sexual intercourse, there are times a woman get injured, and all of these are reasons for why a woman can get HIV more faster than the male. Now, I want to say that, okay, so that's that about that. And then from the graph below, you could see that um, women ranging from Niger downward, you could see that the woman actually, if you look at the graph from Niger down to Gabon, you'll see that the women are at highly, their infections rate is high. That is, the women are more vulnerable to this HIV and AIDS infection we are talking about. So, as a woman, I'd advise you take your health very seriously. It is very important you value your health, like I said, because your health is good. You know why? Because you have to live to see that your children grow up. You have to take care of your children. You need your life so that you can take care of your children, and also you need as a woman, you make use of the hospital more often. It is actually the woman who gives birth. It is actually the woman who makes use of a lot of equipment on our body, for beauty, just to to be able to, for beauty stuff. And then also a woman makes use of things like needles, in the salon and other things. And most times women get infused with blood, in the hospital, especially during childbirth, and so on and so forth. I will be talking about the channels women should look out for, in order to avoid HIV infection in my subsequent video. So kindly subscribe to this YouTube channel and hit the notification bell for other updates. It is very important. All right, so I'll talk about some key points on why women are more vulnerable, like I said earlier, but I'll just say I'll just expatiate little. Of course, women have lack of access. In some African countries, there are some women who lack access to healthcare facilities. Okay, so of course that also can delay the fact that a woman would know what her status is. All right, then we have another issue is this lack of access to education. Of course, some women don't even know what HIV and AIDS virus is, and this is very critical. And then another thing is, there's what we call the gender-based violence and intimate partner relationship violence. You see, among women, this is a great challenge because a study has actually shown that most women are being threatened, and as a result of that, they engage in some kind of act that is not proper. Then some people engage in transactional sex. Initially I talk about sex workers, and also this is an aspect of sex workers. Some people engage in transactional sex, and of course this happens between both women and young men, and it's common in different parts of the world. Okay, and then this is because most relationships in nature are being exchanged for commercial stuff, not just for pleasure, but just for commercial stuff. What's to gain, mostly what to benefit from it. The relationship motivated by this implicit assumption will actually usually is used to exchange for material support or other benefits. So and of course this challenge arises from comes from the fact that it is harmful. It is an harmful gendered situation whereby the female, or sometimes they feel that men are responsible for providing certain material resources and women are responsible for providing sexual and domestic services. So many of these relationships include emotional intimacy with people referring to themselves as boyfriend and girlfriend, and those people, they don't even know their status. Some people call them lovers, but they don't know their status. What do you do as a young lady? Young lady should know the status of whoever she's going out with. This is very, very important, because you see, it's better you know the status of the person than you coming in contact or falling a victim. All right, so I'd advise that you know the status of whosoever you are having an affair, or your partner is. All right, so because it's going to go a long way in helping you to overcome or to prevent you from being infected. All right, so however, the CDC are actually making serious efforts to ensuring that women and girls have access to HIV prevention services, and this is a critical case going on, and this is particularly important for adolescent girls and young women, of course, in high prevalence area, or in places where there is high in places where they have a high risk of being contacted with HIV. Okay, so I'm going to stop here, and then I hope you enjoy, or I believe you enjoy, this educative aspect of my video. So if you like my video, kindly give me a thumbs up, and then don't forget to subscribe to my YouTube channel, and also hit the notification bell. So let's join hands to fight HIV and AIDS in our world. You can as well share this link, or this channel, or this link to your loved ones and friends. Why? Because you love them and you want them to stay away, or to prevent themselves from being infected with HIV and AIDS. Not just that, also to protect other people who are around them. For those of you who are positive, to protect you, learn how to protect yourself and other people around you from contact with HIV, because you love them. All right, and also you can also visit my YouTube channel to explore various teachings as well as resources on HIV and AIDS, of course, for and then if you want to know how to keep yourself healthy, whether you're living with HIV or not, you can visit my channel, and also you can chat me up in my email, through my email, and I will respond to you. So don't forget, let's join hands to fight HIV and AIDS in our world. Thank you very much for watching. I will see you in my next episode. So take care of your good health, of your health, stay healthy, and bye.